Welcome to America's Healer with Dr. Jason West. Dr. West and his guest experts are about to open your eyes to a whole new perspective on the medical world. Now, here is your host, world-renowned Dr. Jason West.
Hey everyone, it's Dr. Jason West with America's Healer. I'm so excited for the show that we have on this Friday, March 10th. And welcome to the show. Today we have some exciting news for all of you looking to improve your health and wellness. And I'm excited to tell you about our sponsor and a new breakthrough that we have, a website that's offering a free ebook called Why We Get Sick and What to Do About That. That's at americashealer.com. Our show today, we're going to be talking about a couple different things. The biggest thing is energy deficits and why pain literally kills energy. But we're also going to be talking about interference fields and nerve reset therapy. And where we're tying it all together, we have a segment called Stomach University. You are what you eat. You are what you absorb. So we've got a couple different things that are just so important. And I'm so excited that you joined me on the show. I wanted to give a special shout out to a couple resources and stuff that you have. Number one is the westcliniconline.com. That is where I work. I'm in a small railroad town in southeastern Idaho, and I love this town. And people come from all over the world to this railroad town. We're able to literally create miracles, and it's not just me saying it. You can see the miracles on our YouTube channel, our Facebook Live, and it's literally we get to change lives every day. And so I wanted to give a shout out to the West Clinic. I also wanted to give a shout out to Personalized NX. This is how we make custom supplements. And literally, I've been able to make a brain formula, a stomach formula, a health formula of the things that really, really work. There is a lot of ineffective supplementation on the market. Matter of fact, I just did this today with the patient that came in with cement in a bottle. Now, when I talk about cement in a bottle, it's about literally calcium that is too hard to absorb, and it's literally like eating rocks. And I think actually that it is really detrimental for your health to be taking the wrong kind of calcium. And I took the bottle from her and I said, look, we could probably throw away the pills and eat the bottle. At least you'll get some fiber. Now, of course, I'm joking when I say that, but I am dead serious that there is some junk on the market. And so that is why I started a nutritional supplement company called Personalized NX. NX means nutrition and supplementation. And by the way, you can get all of the information on Personalized NX and our ebook, Why We Get Sick and What to Do About It. We co-wrote it as providers in the clinic, myself, Dr. Nelson, and Shelby Stoddard, the world's greatest nurse practitioner, of what's wrong when people go off the rails and aren't very healthy. And you can get that book at www.americashealer.com. Also over there is a personalized evaluation that lets us give you an idea about how to get the right supplements built just for you, so you don't have to walk around with or travel with 6 or 10 or 12 different supplements. Literally, we can get all the supplements in one bottle. If you're watching this on Facebook or YouTube, I'm just going to give you an example of this. This is one that I made for my son, where literally we can go into the pharmacy and we can take out the right kind of calcium, magnesium off the shelf, put it into a supplement. We can add herbs, we can use vitamins, we can fats. It's the future of medicine. We call it custom formulation. And literally we can do things that weren't even possible a couple years ago. Now we can get it's called supplement consolidation. It saves money. It helps you it makes it easier to travel. You don't have the pill volume. For example, I made a formulation myself that has stuff in it for my prostate, for my heart. I'm concerned about dementia and forgetfulness, so I did it for my brain. I have fats that protect the nerves. I have zinc and vitamin A and vitamin D and the right kind of vitamin C for my immune system. I literally created my own formula with the help of the compounding formulation company and the pharmacist, and now I've been able to do it for people. So that's part of the radio show. But you guys, today's topics, we have a couple of them. And number one, it's literally about what we can do to avoid the energy deficits. And so I wanted to take this segment and talk specifically about natural treatments for pain, because pain literally kills your energy. It's the thief of joy. And if there's anything naturally that we can do to alleviate pain, I really want everybody to hear about it. And honestly, for one of the biggest reasons is because we don't want a dependency on everything. Like I get over-the-counter medicines, Tylenol, ibuprofen, aspirin, I get it. I understand, some of the, quote, lighter prescriptive medications for pain, and then there is dependency prescriptions. If there's any way that we can help people to know of their options and be able to live life with reduced or eliminated pain without having to resort to some of the unwanted side effects that can come with over-the-counter medicines, or with some of the dependency prescriptions. Like, I fully believe no one wants to have a dependency on, some of these really powerful opioids. I don't think anybody starts off that way. And unfortunately, it can really put the hooks into people, and it can create some difficulties. And so that's why I was like, hey, you know what? Let's do a really neat thing about pain. So, by the way, you guys, if you missed the different shows, you can pick those up on iHeart, on Spotify, on Pandora, on Apple iTunes, and of course, Voice America. You can go and get on our show and see the replays. We've had some great topics in the past on energy, on literally how to navigate chronic viral infections. We did one last week about the different problems in healthcare and what to do with health insurance. So let's jump right into our subject on pain-killing energy and fixing the energy deficit. And it really comes down to inflammation. Now, inflammation isn't necessarily bad. A lot of times people come in my office, they'll be like, Dr. West, I do not want to have inflammation. And I always gently remind them, well, you want to have controlled inflammation, because you need inflammation to heal. That's part of the immune system cells that attack your body. They have cells, and when I say attack your body, if you injure yourself or you have a virus inside of the cell, we want the immune system to cause inflammation and get rid of it. Now, when we have mismanaged inflammation, and that's in the cause of autoimmune, or for example, like if you sprain your ankle and it swells up and we get all this redness and heat and everything there, if we can control the inflammation, now we have a really good healing response. And chronic pain is the type of pain that it's a vicious cycle, dealing with like arthritis pain or chronic nerve pain or complex regional pain syndrome, or migraines can affect sleep habits. It really can affect your exhaustion. And you know what? If you can't sleep, you can't heal. And so the side effects of some of these common medicines, it's always surprising to me. I ask people, hey, what are you taking for prescription or medicine? So that I just want to make sure if I'm treating the person or I'm treating, some accidental side effects. And so many times people say, well, I'm not taking anything. And I'll say, well, what are you in here for? Well, my shoulder hurts. Well, how are you handling that? Well, I just take 8 Tylenol every day and I'm fine. And I was like, well, wait a minute. Tylenol is not to be designed to use that way. It's so hard on your liver. And the patients frequently will say, oh, yeah, I forgot about that. Because you think if you can go in and get it and you don't have, have to have a prescription, people are thinking that it's benign. And it's not benign. Unfortunately, some of the side effects from some of the medicines, literally are just horrible, undesired, of course. But medications that for aspirin or Aleve, some of them may actually increase the conditions that you're thinking it's helping. Like if we have too many problems with, or you take too many Aleve, like it is going to really cause other health problems, particularly kidney problems. And when it comes to prescriptive medications, so like cortisone or prednisone, like it's a great short-term medicine and it causes horrible long-term medication problems. And the worst activity of all, and this is a picture of a gentleman sitting in an easy chair with a remote, is inactivity. So when people don't feel good, they have I don't want to do, I don't want to move around. Well, it's going to cause problems. We're designed to move. Movement's one of the most important things for health. Now, when you have an ankle, a sprained ankle, you don't want to go run a marathon, or if you've really hurt your knee, it's hard to go up and down stairs. If you have back problems, like, there is a time and a place for rest, but there's also a time and a place for movement. And a lack of movement, in 2017, there was a study published in the Journal of Scandinavian Medicine and Sports, and found that people with chronic pain problems associated with myalgic encephalopathy or fibromyalgia, and those are kind of the common diagnosis, or, used to be chronic fatigue, and then we kind of moved into fibromyalgia, and now we moved into myalgic encephalopathy. They mean a lot of the same things, and a lot of it's just how the doctors give you the diagnosis, but physical inactivity exacerbates fibromyalgia. And another cause of fatigue, and this is why it's so important when people are in pain and then they're tired, it's so important to do a workup. Matter of fact, I just found this out for a patient that literally has some chronic stomach problems, really, really hurting. And we thought, of course, it was, digestion and bloating initially, or maybe it was polycystic ovarian disease or endometriosis. It was in a younger female. And she's like, I'm so tired. We get really tired. I have, problems with my pelvis. And we did a routine blood test and ran an iron count. We found out that she was anemic. And so when we start looking about how pain affects energy and energy affects pain, and they're all together, and then I wanted to put a segment in here on stomach, because you are what you eat and you are what you absorb. And when you go to put people back together, we really want to balance the system. So if you are in a situation where you are not feeling very well and what you've tried hasn't worked, or it's not working as effectively, you need to go see a doctor like me or myself. You can go to West Clinic online and get information of how to be a patient. And when we do a workup, and we start off at the beginning, and here's what that means. We want to do a medical history. We want to look at labs in the right way, do a complete blood cell count, a metabolic panel. We want to do some simple, easy tests. Matter of fact, one of the most beautiful things that you can do that doesn't cost any money other than a blood pressure cuff. And you can get these at, Walmart, you can get these at drugstores, you can get these on Amazon, is you get a blood pressure cuff. And one of the best ways to figure out, get a peek into your fatigue pathways is literally to get a blood pressure cuff that measures your heart rate. And what you want to do is you want to lie down for a couple minutes, and you want to get a lying down blood pressure and pulse rate. And you can literally do this on yourself. You put your cuff on the left arm, and you can look at the digital reader handout. Your blood pressure should be 120/80. Your pulse rate should be 60 to 90. And then there's a wonderful test called Ragland's test. I mean, other than paying for the blood pressure test, this is so good for people. And that is to stand up and to take your blood pressure and look at your pulse rate again. And what should happen is your pulse rate should stay the same, and your blood pressure should go up 6 to 10 beats. If it's not, it's a classic sign of adrenal exhaustion and cardiac fatigue. And as we start unraveling the segment of what we can do, natural treatments for pain, and why pain causes fatigue, and why fatigue causes pain, and why you are what you eat, and why you are what you absorb. And when you do a workup and you start putting the pieces together, now you have the opportunity to really change lives. And so I want to skip through a couple different segments here on my presentation that I put together, and talk about some conditions for pain, because if there's one thing that we could do that'll really help, if people are listening, it's to do this. We want to help you in natural pain control, and that is improving your essential fatty acid intake, some omega-3s, 6s, 7s, 9s, and 12s, and also by combining that with a proteolytic enzyme. Now, what is a proteolytic enzyme? It's an enzyme that helps to chew up the wrong kind of inflammation. When you combine those together, and you literally, you can get this information right on americashealer.com, where there's a wonderful way of saying, look, let's just help you with natural treatments for pain. if you combine essential fatty acids and proteolytic enzymes, it has a similar effect to the anti-inflammatories over the counter, but it doesn't have the side effects of hardening your liver and damaging your kidneys and chewing up your stomach. And so literally for natural pain relief, it's listed right here. You can go to americashealer.com and you can look at WHIP, which is a proteolytic enzyme. It's made by Personalized NX. Triple P has all of these different types of fats in it, DHEA and EPA. Joint Freedom has some collagen peptides and some acetyl myristoyl. We talk about all the time. It's CMO. What CMO does, it's like a supercharged glucosamine. And then one of the very best fats, and you don't have to take all of them. You can just take Triple P, which has different kinds of fats in it, or you can take astaxanthin, which is what the fish eat to make fish oil. Like if we have healthy fats into your system, we have a wonderful opportunity to natural treatment for pain. So check us out there on americashealer.com. We can get a lot of information. We actually have a free book giveaway there. That's wrapping up our segment. We're talking about natural pain relief. We're going to come back. We're going to be talking about a nerve reset. I'm America's Healer, Dr. Jason West, and I'll see you right after the break.
You're listening to America's Healer with Dr. Jason West. If you have a question for Dr. West or his guests, feel free to join us on the show at 866-472-5792. That's 866-472-5792. Now, back to the show.
All right, you guys, welcome back to the radio show, America's Healer. I'm your host, Dr. Jason West on Voice America, and I'm so excited to share with you segment 2 of how to help chronic pain and chronic healthcare conditions by checking out interference fields and scar therapy. And so the first segment, we gave a little overview of natural pain relief, so I just wanted to recap that. And here's what I'm talking about with that, and that is using a proteolytic enzyme, small, medium, and long-chain fatty acids. And if you're having joint pain, arthritis, muscle pain, you can use acetyl myristoyl, which is a supercharged glucosamine, and it's all available on americashealer.com. So go check it out. And by the way, it's not just supplements that you can talk about. I'm excited to tell you this. I wanted to talk to you about, health and everything associated with it. And we decided, the providers in our office, we wrote a book called Why We Get Sick and What to Do About It. And it's available as a free ebook on our website, americashealer.com. Now, it's packed with information that helps you understand the root causes of many health problems that plague our society today, and it's a comprehensive guide that will show you how to take control of your health and live your best life. So if you're sick and tired of being sick and tired and not as vibrant as you'd like to be, I encourage you to head over to America's Healer and just get the free ebook. Now, while you're over there, there is a wonderful evaluation where we can help you get more information about hormone imbalances, about fatigue, about infections, about how to streamline your energy levels, how to operate at the highest level. Of course, it's complimentary, so don't wait any longer. Go check us out, americashealer.com. So thank you for tuning in on Voice America. I'm your host, Dr. Jason West. By the way, you can pick up our replay on Facebook Live, on YouTube Live, Pandora, Apple iTunes, Google Podcasts, and then, of course, we're live every Friday at 1 o'clock Mountain Time. And here we go on segment 2. I have got to tell you about one of the funnest things that I've discovered over the last years, and that is about interference fields. Now, the best way to talk about this, or best way to explain it, is for you to recognize that, religiously, and there's all of these different religions have a variation of this. When your progression is stopped, we call that damnation, right? It's like a dam blocking water, like there's no flow. Well, that's what interference fields are. And it's the blockage of energy in your meridians and in your energy pathways. And it's so important to deal with those so that we can help get the body to heal. So if I talk about scar tissue interference field, when the skin is cut as a result of injury or surgery, it's densely packed with nerve fibers. So there's all of these pain signals. It's a protection mechanism. Then it immediately goes from the peripheral nerves to the central nervous system to the brain. And as the body heals, sometimes the nerves may heal poorly, disrupting the overall function of the autonomic nervous system, and the signals may be transmitted improperly, and the nerves may join in an aberrant fashion. So we have a chaotic or noisy sympathetic nerve activity on a scar. Now, according to neurologist Husheng Humand, it refers to an island of turbulence in scars. And by the way, you guys, it's not just from a cut. It's not just from a surgical incision or a wisdom tooth removal or a mole removal. It can actually happen from infection. So we can have infections sometimes, and unfortunately it happens in shingles, where you'll get the red inflamed area. Then you'll get these little pustules that come out, and those are highly infectious. And then when the pustules go away and the body gets on control or on top of the infection, unfortunately, in some people, the nerves get caught up in this catch-22 cycle of I hurt, and it feels like you've got a hot iron up against your skin. And we call that post-herpetic neuralgia. It can also happen with, we have rodeo rancher guys come into the office and they'll be out practicing roping, and they'll rope a calf and they'll go over and they'll get their rope caught around the finger, and sometimes the calf will jump up and run away, and that rope caught around the finger will pull the finger right off. I've had this happen so many times, and the roper will say, man, my finger's killing me, even though it's not attached to the body. That's what we call phantom limb syndrome, and it can happen with fingers, it can happen with toes, it can happen in past surgical interventions, it can happen in gallbladder situations. And when we have this aberrant area of nerves, what can happen is it can cause nervous system dysfunction. And so literally disease can be an energy blocked by these inner fields. It can be just like a river that's dammed. And scars can harbor emotions. So, I have a picture that I'm going through in my slide deck here of these different reactions for people that have scars, because I've had people literally, when we start working on these interference fields, number one, it's like letting him out of prison. But number two, every once in a while, it'll have people relive the emotion of the event. And so it's called secunda phenomenon, known as a lightning reaction, or a Huneke phenomenon. Some brothers discovered it in the practice in Germany between 1920 and 1945. And scars, what can happen is they can have these adhesions to deeper sliding structures such as tendons, muscles, fascia, and viscera. And a famous French surgeon, Dr. Jean-Claude Guibarteau, showed that scars really can have a huge impact on healing and the health of the patient after the surgery. So I have a zipper picture here where this surgeon was saying that adhesions from scar tissue are attaching, and they can restrict sliding motion of tendons, and they can, like in a C-section scar, it can have ovarian adhesions. And the scar tissue constitutes natural repair for the body, and the wounds can healing with collagen, but sometimes it can restrict motions, with the physiologic exchange between the connective tissue, but it can also interfere with nerve, blood, lymphatics, meridian, skin, fascia, and other tissues. And so when we talk about what you can do for health, this is one of the most important things that people need to be aware of, and arguably the most important thing that I offer inside of the office is we can reset this. We can reset the nerve conditions. And I want to be careful when I say that. I get excited because I've seen so many miracle stories. And again, it's not just me saying it. You can see the hundreds of patient success stories on our Facebook channel and on our YouTube channel. But it isn't we fix everybody. Sometimes you can't turn around phantom limb syndrome or post-herpetic neuralgia. But I always get so excited when someone has that, because for the most part, you can make a substantial difference in this. And so scars, a lot of times they have a different temperature than the other tissue. Sometimes it can, plus or minus a degree. And the electrical resistance, like scar tissue is a normal tissue. We have all of this fibrinogen and we have collagen there, and we have a disruption of electrical pulse. And so it can happen when, an accidental trauma, accidentally cutting yourself, fishing accidents, knife accidents, trauma, of course, accidental interference fields from surgery. I mean, if you have a compound fracture, of course the surgeon has to reset the bone. And I believe there's no intention of having any residual, scar tissue. That's just what happens when you disrupt the skin. And it can have this other component of health known as the fascial drag, which is the transmission of tension from one area of the body through the fascia. And it makes it so that the skin doesn't slide on the other tissues the way it's supposed to. And there was another researchers, 1983, Upledger and Bredogood, an example of a patient with chronic migraines produced by an appendectomy scar. And it's also important to know which direction the scar was going. When the scar was pressed deep medially, so pushing down and going towards the midline, the headache was reproduced. When the scar was pressed laterally, the headache was relieved. So in this treatment that is so important to know for fatigue and chronic healthcare conditions, when you literally can help reset the scar interference field, then literally local disturbances that can cause problems in, again, an appendectomy scar that cause headaches, but there can also be mole removal scars that can cause internal organ problems. I've seen this happen, mole removals from the back. And then people say, man, I've just really struggled with indigestion. And you reset those scars, which we're going to talk a non-invasive way and an invasive way to do that. And then there's a way to assess the scars and look at, is a laparoscopic scar. By the way, everybody has scars. A lot of times they're not aware of them. I've had people say, I don't have any scars. I'm like, well, for sure, you've got a belly button scar. And if you don't have a belly button scar, like now we want to call, Men in Black and see if there's been an alien abduction or an alien that's living. And of course, I'm joking about that. But also, one of the biggest significant scars that I see such enormous patient relief from is tonsil scars. There can also be episiotomy scars and circumcision scars. And scar characteristics, they can be painful, they can be itchy, they can be clearly interfering with movement in the fascial planes. Sometimes the scars are not painful. They're non-tender scars. But you can see abnormal thickening, tenderness, ticklishness, temperature changes, or textures of the skin. And in the textbook of naturopathic physical medicine, there's literally a way to describe the scars where as you feel them, you can feel and resistance, and you can feel it just doesn't feel right. And so using your hands, which I think is becoming more and more of a lost art in medicine, when you palpate these tender areas, these neuromas that are benign accumulation, neuromas are these bundles inside of the nerve tissue. I meant to say, I was talking about lipomas, but I meant neuromas. Now, lipomas are benign accumulations of fat, but sometimes when you feel those little bumps, sometimes they're neuromas, or they can be, different types of tissue. But it's fascinating to me when you literally can work with people and you can recognize, hey, there's some neat ways to reset scars. So there's an acupuncture consideration where we literally are surrounding the dragon. There's some myofascial methods that help, manutissule manipulations or literally rubbing the scar. And one of my favorite things to recommend for people is to take a natural source of wheat germ oil, these little pearls. They're not capsules and they're not pills, they're pearls. So they have, basically you can pop them with a pin or you can cut them with a knife, and literally you can rub those on the scar. You can also, I really like cold pressed castor oil is one of the best things you can do naturally without needles, without acupuncture injections to get scar tissue to improve. There's also some considerations. I love dimethyl sulfur oxide or DMSO. It's so helpful to break up hardened tissue. I love it as an external or as an internal. And then also some things that can break up internal tissue, like scar tissue for lungs. One of the best things you can do for COVID recovery is to use some intravenous dimethyl oxide or DMSO, which a lot of people that have horses and animals can recognize that, but also IV glutathione. It helps to break up these internal scars or these deep scars from surgery. My favorite way to do it is to use a glycolized ether of paraminobenzoic acid. So it's a sugarified B vitamin. And literally it makes the nerve endings hyperpolarize. So they want to open them up and then depolarize, which makes them close, and then repolarize, which gets them to reset. And this is used through this wonderful, fascinating chemical called paraminobenzoic acid. And it literally helps to get the scars to reset. And it's literally, if you have computer problems, and this is like what happens with chronic pain problems, chronic health problems, chronic stomach problems, one of the best treatments that I've seen inside of the office is to use this chemical, paraminobenzoic acid, in the right way to reset asthma. You can use it to use the infraspinatus respiratory reflex, the IRR treatment, and literally it's like your body's computer. If it's not working right, we call it tech support. Tech support says, oh, well, you should reboot the system. Now, this is a joke. I tell people we can't really kill you and bring you back to life, but we can get the nerves to reset. And that is such an important part of chronic pain. If we improve pain, then we can improve energy. And if you have your energy, literally so many health care problems can be overcome. Now, if you're having chronic health problems, don't forget to check out our sponsor at the West Clinic. This is this wonderful clinic that I work at in a little railroad town in Pocatello, Idaho. You can get information on www.westcliniconline.com. I also want to give everybody a big shout out to go check out our sponsor, our website for our radio program. It's on Voice America and syndicated through Apple iTunes and podcasts, Spotify, Pandora, and everything. Is we have a wonderful resource for you called Why We Get Sick and What to Do About It. It's an ebook available at americashealer.com. Everything that I'm talking about in the show, it literally is over there on the website. That is this part of our segment. We're going to come back, and I've got something about Stomach University. Stick around. It's Dr. Jason West, America's Healer on Voice America Radio.
You're listening to America's Healer with Dr. Jason West. If you have a question for Dr. West or his guests, feel free to join us on the show at 866-472-5792. That's 866-472-5792. Now, back to the show.
All right, everybody. Happy Friday, March 10th, 2023. This is Dr. Jason West, America's Healer. Thank you so much for tuning in because you care about your health or the health of a loved one. And we've covered a couple different things in this radio show. You know, natural treatments for pain. So if you're joining us late, that is using a combination of essential fatty acids. So you want your long, your medium, and your small chain fatty acids. And when you combine that with a proteolytic enzyme, it has a wonderful pain relieving effect that doesn't have some of the undesired or unwanted side effects of over-the-counter medicines or opioids. Now, it is not instantaneous. I forgot to say this in the first segment. I want to tell you now, it's not instantaneous. You have to build up to it. It usually takes 7 days or so to kick in. So if you have a headache, you can't take the proteolytic enzymes and the essential fatty acids and think it's going to go away in 30 minutes. But if you take it consistently, it can really improve your quality of life. We also talked about the importance of having a medical workup where we're looking at the whole body and not just the symptom. And what I mean by that is so many times people will come in and they'll say, hey, this is what's wrong. And then when you start diving in, you'll find out, no, that's secondary. For example, I had someone come in saying, I just got horrible, neck pain. I've got some scoliosis. And yes, scoliosis, when the vertebrae are not lined up right, absolutely can be a pain generator. But I started saying, well, what are the other things that are happening for you? And then it was, well, I've got scars. I've got stomach problems. I've put everybody else first. I need some time for me. I haven't had a blood test for a long time, never had my hormones tested. And as we started doing that for this patient, now we give the patient a sense of control. And why that's so important in healthcare is because a lot of times the reason why people don't feel very well is because they're out of control. And you'll say, well, wait a minute. Well, let me give you an example. When someone comes in and says, Dr. West, my shoulder hurts, that's not what they mean. It's just the verbs, it's the words, the verbiage that they're trying to communicate with you. But what they're really saying is, hey, I've lost something. I've lost this quality of life. I can't lay on my side. I can't throw baseball. I can't hug my spouse. I can't do my hobbies. I can't sleep at night. And so their body's out of control. And you have to help people to understand, get their body back in control. This is one of my favorite things to do. So we were talking about natural treatments for pain, which is one way to describe, we have some things out of control in our body. And then we wanted to talk about chronic pain. And chronic pain literally causes fatigue, and fatigue causes chronic pain. It's like this roller coaster go around. And so you've got to figure out why people are fatigued. Is it because they're tired, or is it because something is imbalanced in the system, or has it become pain? Pain absolutely robs energy from the body. When you don't have energy, then what happens is your stomach doesn't work right, or your muscles don't work right, or your joints start to hurt. There's so many reasons why pain causes fatigue and why fatigue causes pain. And I'll make the statement over and over again. If we can find a way to restore your energy levels, and of course, one of my favorite ways to do this is by getting electrons to the body through vitamin C. Vitamin C literally donates electrons to the body. If we can do that, then we win. We see people beat their disease. And again, it's not just me saying it. You can see our video testimonials on Facebook and on YouTube. Our Facebook channel is literally facebook.com/The West Clinic. And our YouTube channel is Healthy Healing TV with Dr. Jason West. I've got, I think, about 700 videos over there. We post stuff consistently on patient success stories on Facebook because I want to give people hope. I love that Arabian proverb that says, he that has health has hope. He that has hope has everything. And literally it comes back to your health. And it's this, you get one car in your life, you get one body, and you can't trade it in, and you can't, you can do some things that'll be healthy, but you cannot just say, I'm tired of this, truck, I want to go get a new truck, or I'm tired of this sedan, I want to go get an upgrade, and now I'm going to go get a Ferrari or a Lamborghini. Or it doesn't work that way. You have what you, and you can make that car last if you change the oil and you do the maintenance on it. If you don't, then as you matriculate through life, eventually you have to pay the piper. That's one of the motivations for the radio program. The radio program, the most frustrating things that I see in my office is when people say, I wish I would have known my options. I wish I would have known that there's different ways to help cholesterol. I wish there was different ways that I knew that I don't necessarily have to get surgery if my joints are bone on bone. There's some regenerative injection therapy. And I wish that I knew that there's something called NHP that stands for natural hormone precursors, instead of just relying on a pharmaceutical that now I'm dependent on that hormone or that prescription for life. And so I just wanted to know people options. I'm absolutely not anti-medicine. There is a time and place for everything. Thank goodness for surgeons. I'm so happy when I broke my collarbone in a motorcycle accident 2 years ago that I ran into a fantastic surgeon locally here. Dr. Watney put me back together. I'm so grateful for him and people like him they're able to have that skill set. My mission, though, is to help people to put their lives back together. And if things don't work, or if we can't fix things, then we want to use more aggressive interventions. And so I'm excited to be able to share this platform. Now, I wanted to give a shout out again to our sponsors. If you are looking for information on why you get sick, you got to go check out our website called americashealer.com. We have a free book over there, a free ebook called Why We Get Sick and What to Do About It. It was written by Dr. Nelson, the world's greatest nurse practitioner, Shelby Stoddard. That's what I call her because I've got to work side by side with her for the last 8 years. And then, of course, myself. We wrote a book, and we want to empower people of if you are having chronic headaches and fibromyalgia and stomach problems and complex regional pain syndrome and mixed myalgic encephalopathy, like so many of these chronic conditions, there are considerations where we can build the body up and make them healthier. And we do that by helping people to eat better, to a positive mental attitude, to the right building blocks, the medical miracle mineral, magnesium, and using electron donations of vitamin C and cleaning out the liver with the right kind of alpha-lipoic acid and using some of these desiccated organ glandulars that help rebuild nerves. And I just had another patient contact me from Arizona saying, is there anything that we can do for kidneys? My doctor says that there's no way to rebuild a damaged kidney. And I so disagree with that. Now, I don't want to mislead people and say that you can take a damaged kidney and make it 100%. But I've seen so many people over 23 years where we make kidney function better. No, I don't have the recipe to turn you into an 18-year-old specimen or make it so that everything's normal. But there are some very advanced nutritional therapies using glandulars, using peptide therapy, using glandular extracts. They give the body building blocks and a blueprint for assembly that helps nerves, that can help kidneys, that can help liver, that can help joints and help about stomachs. Now, I wanted to talk about that just for a minute because the way to beat fatigue and the way to improve pain is through this wonderful complex organ system known as the stomach. And most people, just kind of will casually say, well, it's your stomach is everything. Well, it's the stomach and it's the small intestine and it's the large intestine and it's how we get rid of waste products. And by the way, your stomach system really starts right here, in your mouth. And literally, if we have a healthy mouth, it's one of the best ways to be healthy. I've seen so many conditions over the last 23 years of chronic health problems and autoimmune problems because people had problems with their teeth. They had, infected tooth. They had a tooth that they just did take care of. They had a rotten tooth. They had an abscess. They had an infection. I'm not a dentist. I just absolutely believe if you want to be healthy, you've got to have healthy teeth. And by the way, that's where all the digestion starts. It starts with literally a saliva. It starts with mastication and grinding things up. And so many people have stomach problems, and they don't necessarily have to live that way. So looking at it, 15 million people can have food allergies, 9 billion people, 6 million kids have food allergies, 9 million adults have food allergies. 18% increase in food allergies from 1997 to 2008, and 50% increase between 1997 and 2011. So guess what, everyone? You are what you eat, and you are what you absorb, and how the food is farmed and gotten to market and how it's treated inside the supermarket system is so important, and so important for you to know. And so it's also so important to recognize that the stomach, we have so many neurotransmitters that go through there. I mean, you are what you eat, you are what you absorb, you are what you think. And if you're stressed out and you're in that fight or flight response, not only is it going to affect your brain neurotransmitters, but it can affect your stomach transmitters. And so food allergies and food sensitivities and how we digest things, it's so, so important. Now, we've got just a couple minutes to go, so I'm going to have to go really fast through these things. Let's just talk about general stomach problems, and let's talk about what is possible to help speed up digestion and to help it, and some things that we can do to protect the stomach. And I wanted to go into food allergies. We just don't have time inside of the radio show parameters. So let's talk about this. So many times people are having health problems because they're not breaking down and absorbing food. And so think about this. If you put food into your system and it's not digested properly, It sits there, it ferments, it rots and decays, so you can get acid reflux, heartburn, and you start bloating. You can get literally what's called a food baby, where your stomach will start to distend because of all of the gases that are building up. You can get a lot of exit or flatulent problems, but just as important, sometimes the body goes into dumping syndrome. And I have people come in and say, if I eat the wrong thing, I immediately got to go to the bathroom. Well, where we start with this, number one, I would encourage everybody to do some simple steps. Number one, I love digestive enzymes. I love apple cider vinegar. Like at the very beginning, if we can figure out where we can help speed up digestion the right way, one of the best ways to do this, take a tablespoon of apple cider vinegar in a half a glass of water, 6 to 8 ounces of water, and literally drink that after meals. If it helps your stomach and digestion, now we know that it's a lack of digestion, and if we can speed that up, now we don't have time for heartburn. Now, about 20% of the time, in my experience, it'll cause people to it'll be worse. And what I mean by that is, if you do have true hyperacidity and you put acetic acid or apple cider vinegar in your stomach, what happens? It will make the heartburn worse. Well, you guys, there's a neat way to do that, is we can calm down the sympathetic nervous system with the vagus nerve. Most of the time it responds to a mineral called phosphorus. Phosphorus helps to literally calm down that vagus nerve that goes to the stomach, and a lot of hyperchlorhydria conditions can dissipate. It's not always an acid blocker or an acid stopper. There's also a wonderful thing that helps to heal and soothe irritated GI tissue called fat-soluble chlorophyll. So this is your vitamins A, D, E, and K, and it helps to heal and soothe irritated GI tissue. There's also some considerations, for aloe vera, which helps to literally protect the stomach, natural aloe vera. But I love moronite clay, also bentonite clay, and these have silica in it, which you always have to be careful. It's not silicone, it's silica, and it can help to heal and soothe irritated GI tissue. So if you're having a lot of acid reflux, we should coat the stomach with vitamins A, D, E, and K. We should try to help break food down so that we don't have acid reflux or we don't have dumping syndrome. And then there's a consideration for using pancreatic enzymes. Everybody thinks the pancreas for blood sugar regulation, and that's important. That is where insulin and things come from. But the other half of it helps to break food down. So digestive enzymes, pancreatic enzymes, and then we got really quickly to diarrhea and constipation. Right? Is the gas too fast and it's like an engine and we're just dumping everything right away? Is it too slow? And that is, constipation. It's huge problems. Half the population is struggling with chronic diarrhea, chronic constipation, hemorrhoids, irritable bowel syndrome, malabsorption syndrome, colitis problems. And so much of it is due to the liver and the gallbladder. Now, a lot of people have had their gallbladders removed. You don't have to have it to be healthy, but you do got to have a liver. And that's, apologize to my mama for bad grammar there for a minute. You do have to have a liver that secretes bile that helps emulsify and break down fats, and so many diarrhea and constipation issues. If we just help to regulate bile, it really, really helps to regulate the digestive system. So ox bile, beet leaf greens are really good considerations. You are what you eat. You are what you absorb. If your stomach's off, your pain's going to go up, your fatigue's going to go up. All of it is connected. If you have lots of fatigue, chances are your stomach's off. If you have lots of pain, chances your stomach's off. You guys, this is America's Healer, the Dr. Jason West program on Voice America. We're syndicated across a couple different platforms. We're here every Friday at 1 o'clock Mountain Time, 12 o'clock Pacific. You can see us on Facebook and YouTube. That's our show for this week. Next week, we're going to be announcing what we can do for advanced kidney problems and internal disorders. I'm your host, Dr. Jason West. Thank you for making your health important, and I'll see you guys next week.
Thanks for tuning in to today's episode. America's Healer, Dr. Jason West, will be back next week to share more of his expertise, so don't miss it. Until then, have a great week.